Hello everyone and welcome to this special video in which I will share with you my experience on my second month of residency, which was on emergency medicine. In the first month I was doing anesthesia, so I was not responsible for writing notes, putting orders. I was mainly responsible for intubating the patients, the pre-operative, intraoperative and post-operative management. That's why this rotation was a different experience. I was not sure how this system works because it was a long time since I took care of patients. I wrote notes, put orders because I was doing research for 3 years. And also I have not done an in-person rotation in this hospital, so I don't know the electronic medical record system. So what I will do in this video, I'll break up the tasks that I was responsible for during this rotation and how I tackled each one of them. First one is to take history from the patient, and this follows the same principle that you learned in school. You go and talk to the patient, try to find out what the main problem they are here for, try to ask them questions to narrow down your differential diagnosis. So start thinking of reasons for this patient presentation. So for example, if the patient is having abdominal pain, start asking questions that would remove or confirm certain diagnoses that causes abdominal pain. Then go to the review of systems, ask them if they have chest pain, shortness of breath, cough, follow all the review of systems to make sure that you're not missing any diagnosis or any symptom that the patient did not mention. Then start asking about the family history, social history, medical history, surgical history, medications and allergies. And as I said, this was not a big problem because it follows the same principles that you learned in school. I did the CCS exam, so that was already included in that. I did my step 3 recently, so I have this mindset of asking the questions and narrowing down the differential diagnosis. So after you finish taking history from the patient, you go and talk to the attending, the faculty, and present the case, tell them what you think the problem is and what you think the orders should be. And then the attendings would tell you whether they think that you should have asked something that you didn't ask, whether you need to add a certain order, whether there is a diagnosis that could be the reason for this patient problem, and based on that you go and put your orders. So I recommend putting the orders before you write your notes, and I'll talk about notes later, but then you go put the orders based on the discussion you had with the attending. For example, if the patient is suffering from pain, you might give them some pain medications such as Dilaudid or oxycodone. If they're having nausea, you would give them Zofran. So you'd give them something to relieve the symptoms that they're suffering from. You would order some labs, some imaging that would help you confirm the diagnosis. On my first day especially, I was not sure how to put these orders because I took some orientations about the system, but I did not do it myself. So I arrived 2 hours earlier. I was observing the residents, how were they putting the orders. I asked a lot of questions. On my first day, I was literally asking a question about every single order I was putting. But after a day or two, you start getting the hang of things. Things become similar, and you might still have some questions about an order every day or two, so that's totally fine. People are there to help you. They expect you not to know everything from your first day, so it's totally fine to ask and learn from your colleagues. And you will realize that after a few days, you'll be putting the same set of orders for most patients. For example, if someone is having chest pain, you will be ordering chest x-ray, EKG, troponin. If someone is having abdominal pain, you'll be ordering some labs to rule out abdominal pathology, CT abdomen pelvis. And these are actually very similar to the step 3 CCS exam. So that's why I recommend doing this part specifically at step 3, because it will help you on your first rotations a lot. An important thing regarding orders is that once you put the first few letters of the order, it would give you the suggestions. So for example, if you're not sure of the dose, it gives you the available doses for that specific medication. And if you're not sure which one to pick, you can go to UpToDate. For example, if you're treating a UTI infection and your attending told you to go and give antibiotics for the patient, you can look in UpToDate what is the treatment regimen for this type of UTI, and you can find the doses as well there. And afterwards, I would recommend going and talking to the attending, confirming that this is the right dose, and then you can go ahead and order it. So that's why, although it might seem complicated, especially for international medical graduates who did not train here, but with the help of your colleagues, with your hard work, with the training systems that are available, you'll be able to go over it. Now regarding notes, take every free time that you have between seeing patients, between having the order ordered and being done. Take that opportunity to write your notes. Don't leave your notes until the last moment, because in this case you will be staying way over your time. So for notes, the cool thing is that there are templates that you can use to help you write the note. For example, in the ED here, we have a template that we can follow. It has certain things that you can just click on and then type the history of presenting illness, the management plan, and then sign the note. Also, you can use auto text. For example, for normal physical exam, you can type N and the whole text will be filled for a normal physical exam. But be sure that you check everything you're putting, because you don't want to put a normal physical exam for someone who doesn't have a normal physical exam. So just double check everything. Make sure you take advantage of the templates, of the auto text, to help you be efficient and be fast in this process. And after you finish your notes, you put your orders, you have to follow up on things, because don't expect that once you click something, it will be done. Sometimes nurses are busy, radiology is busy, so that's why you have to follow up on things. You realize sometimes you put an order and nurse was busy with something else, so you have to go and tell the nurse that I put this order, was it delivered, when it will be delivered. Go update the patients about what's happening, because with you being busy, with everyone being busy, sometimes the patient is sitting there and tests are being ordered, the patient is taken to the CT scan without knowing what's happening. So take a few minutes, go update the patients about the progress so they know what's happening. And finally, for us in the emergency room, after you put your orders, you write your notes, you have to reach a decision whether you admit the patient in the hospital, you discharge them home, or transfer them to another institution. So this is the final stage in your care of your patients. In addition to the orders or CT scan labs, sometimes you have to put consults, especially in the emergency room. For example, if a patient is having subdural hematoma, you need to talk to neurosurgery, see if they want to intervene on the patient. If it's an eye problem that you cannot manage as an emergency medicine doctor, you have to talk to ophthalmology. So talk to the other services, take updates from them of what they think should happen, and then update the patient as well. And finally, after you reach your final diagnosis, you have to decide whether you need to admit the patient for further management, sometimes further evaluation. Sometimes you don't reach a decision or final diagnosis in the ED, so you would need to admit the patient for further evaluation and management. Sometimes you discharge the patient because you reach diagnosis, you solve their problem, or you solve the symptoms that they're presenting with, but you need outpatient follow-up for them to figure out what the real diagnosis or what the final diagnosis is. Or you can transfer them to another institution if you don't have the resources to treat the patient with this diagnosis. A few tips on emergency medicine specifically, that you have to be efficient. There is a large number of patients, so whenever you're taking history, whenever you're doing the physical exam, when you're doing the orders, you have to be efficient. You should not waste time, and you should go and ask the right questions in an efficient way, because you can't stay for hours talking to the patient, and you can't do it in a few seconds and miss important diagnosis. So you have to be spending the right amount of time, right questions, and you will improve with that as time goes on. Also, it's hard on an emergency shift to go to the cafeteria, order food, spend your time eating. So be sure to have like some food brought from home or some protein bars, because these will be your friend when you're very busy. This has been my experience on my emergency medicine rotation. It was a wonderful experience. I would like to thank all the attendings, all the residents, the medical students who helped me during this process. I would like to thank you very much for watching this video. If you have any questions, leave them in the comments below, or feel free to reach out to me on Instagram or Twitter at Malka Assad, or my Facebook page, Malka Assad MD. Thank you again everyone so much for watching, and see you in future videos. Peace.